The death toll from the COVID-19 virus outbreak in China has jumped to 1,770, and more than 70,000 people have been infected nationwide. But there is some positive news. The total number of patients who have recovered has passed 10,000, and new cases outside Hubei are declining, while within the province, the fatality rate has dropped. Now, despite this, global concern remains high. The head of the World Health Organization has warned it's impossible to predict the future path of the outbreak. International experts have begun meetings with Chinese officials on tackling the epidemic. They will visit Beijing, Guangdong, and Sichuan over the next few days. China may also postpone its annual parliament session next month as the country battles to control the spread of the virus. Our correspondent, Nanette Lim, has been following the latest developments. She joins us now.
Nanette, thanks so much for coming in. Now, what happens if this parliament session is then postponed?
Well, these parliamentary sessions are the most important event on the government's work calendar for the year. So when they're postponed, it means that, the previous year's work plan can't be reviewed, and the coming year's budget and plans for the government, they can't put them forth. Also, it's traditionally a platform for new laws to be passed, for ministries and key state organs to, make changes and make key announcements. So now all that's going to have to wait. And at the same time, it's also a key platform for the official GDP forecast for the coming year to be revealed. So we'll also have to wait for that. But speaking of meetings, on Monday, China did announce that Wang Yi, Foreign Minister, will be visiting Laos from this Wednesday to Friday to chair an ASEAN-China meeting on the COVID-19. Previously, in 2003, there was also a similar meeting that helped in the sharing of information and in collaboration.
Lynette, authorities are still scrambling for a treatment for this virus. Do you have any update on that?
We still don't know a lot, but we do know that authorities have been experimenting with HIV drugs, Ebola treatment medicine, for example, and even traditional Chinese medicine. But for now, one recent report that came out that's really encouraging is that the plasma that's donated by recovered patients, they're found to have virus-neutralizing antibodies. And when this plasma that's been, extracted, tested for safety for, other pre-existing diseases, and obviously also separated from the blood, when this treatment is being administered, patients actually report improvements in the clinical symptoms, and they have so far tested it on at least 10 critically ill patients in Wuhan alone, and within a 12 to 24-hour period, they have shown great improvement.
Well, indeed, authorities are doing their best. Thank you so much, Lynette, for that update.